Makeover is a solution for clinicians to introduce a full smile makeover workflow into their practice. So it begins with aligning the teeth. So that's Reveal Clear Aligners, which is a Henry Schein orthodontic product. So the brilliant thing about that is that with it being Henry Schein Orthodontics, we have 40 years experience of moving teeth the traditional way. So in that we have clinicians that work for us, orthodontists who will look over cases and offer clinical support. So it's brilliant for dentists that are just starting out in their career, fresh out of university and everything like that. So once we've aligned the teeth, we move on to bonding or whitening. So whichever what we're going to do first. So we're going to do the whitening first to get all of the teeth into the right shade. We use White Dental Beauty. So that is Optident's own whitening system, very, very popular. The brilliant thing about it is that there's loads of percentages to choose from, so there's lots of options. We start with a 5% for really sensitive patients, patients that really struggle and maybe have had a bad experience in the past. They can still whiten their teeth. And we move on then to the traditional 6% hydrogen peroxide, 10 and 16% carbamide peroxide. And then we move over to composite bonding. So that is a tough one for lots of clinicians. They don't know where to start often, but we have a really easy and simple solution for freehand composite bonding. So it starts at the B1 shade and gets brighter, so perfect for those really bright white smiles that lots of patients are asking for at the moment. Once we finish the smile makeover, we have the option, the refresh option, which is our new White Dental Beauty strips. 6% hydrogen peroxide, and they are to be used in between maybe aligners or just as a little refresh before a night out. The Confident Smile Makeover will benefit your patients because they come in and they have an option straight away. So often what happens is, we work in industry, we know what's going on, patients don't. So we know that about 43% of patients within a practice don't know about the offerings. So that's 43% of patients that would maybe look elsewhere. So what we do is we introduce that full workflow to the practice, and it just means effectively the dental practice becomes a one-stop shop. So they come in and they have their consultation for their aligners, the treatment plan gets sent back, and from that plan we can show those patients where they might need some edge bonding, where they might need some composite bonding, things like that. And also it's just a brilliant idea for them to have an idea of cost as well, because they're not going to go through the aligner process and then have a big cost at the end. They're going to know exactly how much it's going to cost, can utilise patient finance and everything like that. So it's very, very good for the patient. To get started with the Confident Smile Makeover, one of us, your Reveal specialist, will come into the practice and we will go through all your needs with you. So we have clinicians that have used other aligners before who can literally get going straight away. So the alignment is always the first part. It's the part that takes the longest, and it is actually the biggest amount of commitment for the patient as well. So once we have all of those things in place to get started, the clinicians can either go on a course or they can just get started straight away. So we work with the IAS, so they do all of our courses for us. Tiff Qureshi and the team are amazing, and we teach you about orthodontics. So rather than just about how brilliant Reveal is, we will do hands-on for you for attachments, IPR, all of those things, how to do a consultation, and the IAS orthodontic questionnaire as well. So it's really simple to get started. Everything comes directly from us at Optident and Henry Schein, so you'll have one invoice from one company to go through, and you've got one person that you need to speak to about ordering and any advice that you need as well. Using an intraoral camera will give us the best quality impression, the highly accurate impression, which means that we know those aligners are going to fit and they're going to fit properly. We don't use attachments in 85% of cases, so we really need to ensure that those impressions are really, really good. What it also means is it streamlines your workflow. So patients don't want to be coming back in for new impressions, rejected impressions, and it means that you will get those treatment plans back quicker as well.